the treatment of dry eye, we recommend 3 basic steps that every patient can have it done at home. 1. Warm compressions. The warm compression, we need 40 to 42 degrees Celsius. It's just warm, it's not hot. We need 10 to 15 minutes and 2 times per day. We want the warm to melt down the lipid inside the meibomian gland and relax the eye muscle. 2. The lid cleaning or lid hygiene. We recommend patients to have the good clean to the eyelid. We want to reduce the amount of bacteria or the demodex on the eyelid and get rid of some excessive oil on the surface. 3. The artificial tears. If you look over the counter, there's so many kinds of artificial tears. Some kind that's come in the little tube that's used per day. That kind has no preservative. You can use as much as you want, even every 5 or 10 minutes. Another kind may come in the bottle. The artificial tears that come in the bottles always contain preservative. So we recommend to use not more than 6 times per day. Another steps that will be recommended by your ophthalmologist. That is number 4. That is the tear stimulations. There's some eye drop that can stimulate the tear productions too. You have to talk with your eye doctor because we need to test some things before we can prescribe this kind of medicine. 5. The steroid. Steroid is action to reduce the inflammations in the eye because sometimes the dryness make very inflammations in the eye. It's controlled by a lot of redness, pain or swelling of the eyelid. In case of the dry eye is very bad, sometimes we need the steroid to calm down the inflammations. But as you know, the steroid have a lot of side effects, so we cannot use the steroid in the long term. Number 6, that is a treatment in the hospital that need the technique of the warm and release the blocking in the meibomian gland. It can be done by 2 methods. Number 1, we call the LipiFlow. The LipiFlow is the machines that insert between the eyelid, provide the heat, and compress to the eyelid. Or we can do it by manually. So our training nurse will release the blocking of the meibomian gland and provide the warm compressions too. 7. IPL. IPL or intense pulse light is very new technology. The IPL can reduce the inflammations, melt down the lipid in the lipid gland, and stimulate the meibomian gland function. And also, the IPL can get rid of the demodex.